Hi, good day, everyone. It's been a pleasure having you join us on this episode of the Yaba Voice webinar. We're happy each time we roll out like this and you are able to join us. It's been a very wonderful day. Raining here. I hope you are having a good time there too. The weather is cool and you're doing very well. All right, so this is the Yaba Voice webinar, and it's a joy to have you join us on this episode of for the month of October. Before we run off in this conversation, I want the medical director to welcome us wonderfully to this webinar. Over to you, Dr. Lubinga Dekide. Oh, yeah.
Thank you very much, Dr. Femi Akitoyese. Good afternoon, everyone. I welcome you to this special edition of webinar by Yaba Voice to commemorate the year 2024 World Mental Health Day. Yaba Voice is a platform for mental health education, advocacy, and community outreach. It is a social media platform of Federal Neuropsychiatric Hospital, Yaba, Lagos, through which the hospital creates awareness and educate the populace on topical mental health issues. Today's topic is prioritizing mental health in the workplace. Prioritizing mental health in the workplace. As we all know, October 10 is observed as World Mental Health Day across the globe every year. And the overall objective of the World Mental Health Day is to raise awareness of mental health issues around the world and to mobilize effort in support of mental health. And this year theme is based on workplace mental health, which refers to the psychological, emotional, and social well-being of employees within an organizational setting. According to the World Health Organization in year 2023, 1 in 6 people experience mental health problems in the workplace. And several working days are lost every year to depression and anxiety. Many risk factors are responsible for this, ranging from excessive workload, etc., etc. Not that alone. Depressive disorder was the most common mental health disorder among most workforces and found a positive association between the presence of mental health disorders and absenteeism. And I want us to know that happy employees are 30% more productive. So providing mental health support makes business sense in actual fact. It
Apologies about
employee
that.
assistance program experts. The first among our presenters today is Dr. Adegbaju. Dr. Dapo Adegbaju was born about 5 decades ago into a monogamous family of 5. He graduated from the University of London with Bachelor of Medicine, Bachelor of Surgery. He worked in different private hospitals before proceeding to residency at Federal Neuropsychiatric Hospital, Yaba, where he obtained the fellowship of the National Postgraduate Medical College in year 2011. He was appointed consultant psychiatrist at the hospital in 2012 and placed in charge of community psychiatry. And he worked in that capacity to year 2021. Currently, is the general adult consultant psychiatrist in this hospital. He's also the middle part chairman of the Medical and Dental Consultants Association of Nigeria of the Federal Neuropsychiatric Hospital Yaba branch. He's the chairman of Service Improvement Committee, the Servicom Committee of the hospital. He's also an active member of the Affective Disorder Research Group of the hospital. He has about 10 publications to his credit. He's married with 4 children. His hobbies include hockey sports, traveling and meeting people, and he is always ready to take part in any activity to promote mental health. Our second great speaker for today is our own Venerable Adelowo Adeshina. Venerable Adelowo Adeshina is the managing consultant of Sages and Scribes, an indigenous multidisciplinary consultancy firm with global outlook. Venerable Adeshina is a social administration graduate of Loughborough University in England. He worked as a research assistant in the university from July 1980 to December 1982 and consulting, with about 18 of which was in executive management in a multinational corporation. Professional bodies, among which are Fellow Nigeria Institute of Training and Development, member Chartered Institute of Personnel Management, and so on and so forth. He is an accredited business advisor and has been privileged to run strategic business sessions, business clinics for a wide range of business ventures. Venerable Adeshina is a certified mentor, a certified trainer, and an accomplished adult learning experience practitioner. He is a full member of the Chartered Institute of Personnel Management. Venerable Adeshina is also an employee assistant program practitioner and a wellness enthusiast. He is a non-stipendiary priest of the Church of Nigeria Anglican Communion, currently serving in the Lagos West Diocese. Apart from his priestly duties, he is also actively involved in voluntary community development and social work. He is the current chairman of the Tioluwani Community Development Association in Ifako-Ijaye, local Community Development Association in the Ju area of Lagos State. Distinguished ladies and gentlemen on the platform, you can see that our presenters today are loaded. I want to encourage you to kindly relax and listen to our mental health experts as we promise you a rewarding session of today's webinar. Over to you, Dr. Kemi Akitoyeshi.
Thank you so very much, the Medical Director, for that arousing welcome and introduction of our guest. We are happy to have everyone join us. Well, please, if you know someone that needs to be here, then kindly reach out to them and tell them that we have started this webinar. And this is not just an ordinary webinar, because we don't talk so much about it, but our life revolves around the workplace. And if we do not prioritize our mental health, then we will not be productive. The Medical Director just said, a happy employee is a happy worker who is also able to be productive and give the best to the organization. So we need to do virtually everything to ensure that we give the best of life to people and ensure that they're able to function. So that's why the theme for the World Mental Health Day this year is focusing on this important topic. Now, we're going straight into the conversation for today. Dr. Adegbaju is going to kickstart that for us. And he's going to be telling us what is mental health in the workplace and some of the most common mental health issues that we can find in the workplace. Over to you, Dr. Adegbaju.
Thank you very much, Dr. Akintoyeshi. And thank you, my medical director, for that warm introduction. As we all know, The theme for this year is mental health challenges in the workplace. As we all know, but before I go into the meat of the presentation itself, I need to clarify some definitions so that people will know what we are really talking about. First of all, what is health? Health is a complete state of physical and mental and social well-being, and not just the mere absence of disease. People usually associate that it is when you are ill, that's when you are not healthy. But there are three components to it. Mental health, on the other hand, is a state whereby an individual realizes his or her potentials, is able to work productively, able to cope with the normal stresses of life, and contribute to the society. If we look at that definition very well, we will look at four key parts: realize your potentials, able to work productively, which is what we do in the workplace, and able to cope with the normal stressors of life and then contribute to society. Now, in the workplace, as we all know, with our current socioeconomic climate, the workplace is beset with a lot of issues right now. And mental health issues are not far from the workplace environment in this country right now. And the common ones we usually have that are very common in the workplace in the current situation, economic climate of the Federal Republic of Nigeria right now, will include stress. A lot of us are going through stress. This one is closely followed by anxiety. We all know that we need a little bit of anxiety in our lives. That's what keeps us going in our everyday to-day life, which is what we call positive anxiety. But majority of it are more or less negative ones, which will impact and impair our performance at work. Depression is another one, which comes after anxiety, closely followed by mood disorders. Now, at times, many people tend to confuse mood disorders with mood swings. Every person in this world is allowed to have mood swing once in a while because you are not expected to be happy all the time. There are times you'll be angry. There are times you express other forms of emotions. But mood disorders are a little bit different because it usually consists of bipolar, depression, and then more or less other depressive disorders in that spectrum. Substance abuse is another one. In order to keep up with the pressure of work, people now tend to take to substances unknowingly, maybe because it is socially acceptable. We find people drinking coffee more than usual. Instead of taking 1 cup of coffee, they now take more than 4 or 5 cups of coffee. Some even now go to the extent of adding energy drinks. And we all know that energy drinks contains a high dose of caffeine. And if the person is not careful, the person can now fall into the state of substance abuse. And then we also have people battling with sleep issues, maybe due to the back and forth of commuting to work. By and large, these are the major or the common mental health disorders. Even though, like I always tell people, any form of mental health disorder can present at the workplace. It depends on the individual and how the person is wired.
Thank you, Dr. Adegbaju. I feel we did not talk about stress, though.
Stress
Okay, sorry.
number one.
I heard anxiety first.
Stress, number one, followed by anxiety.
Because what we are carrying now, is huge. It's really, really huge. So thank you so very much, Dr. Adegbaju, for that. Stress, anxiety, depression, issues, and quite a lot. Sometimes you want to close your eyes and you remember that there are still assignments and things that you have not even done. Before you know it, sleep goes off, and then you have to and it becomes a pattern that you are conditioned to. All right, so thank you so very much for that. We're going to go over to Venerable, who is going to talk to us about the factors affecting mental health in the workplace. What are those things that put people at risk to having mental health issues or facing all of these challenges in the workplace? Over to you, Venerable Adedawo.
Let me first thank you, Dr. Akintoye, for inviting me, and let me acknowledge publicly that the medical director, Dr. Weye, is my lecturer at LASU, where I'm currently pursuing a master's degree in social work. Thank you very much for inviting me. Mental health in the workplace. I read recently from a European report that stress is at pandemic level in the workplace. And understandably so, because we now work longer hours as a result of the digital age we are in. It is said that we are in the most destructive era in human history, where we are perpetually subjected to stress as a result of inflation, uncertainties around us, both economic uncertainties, political uncertainties. So a lot of people in the workplace are suffering from burnout. They're not able to, people talk of work-life balance. It's virtually impossible in the world we live in today to even get an harmony between work and life, not to talk of work-life balance. So there's a lot of burnout in the workplace. And what are the causes of this? Number one, the uncertainties in the economic sphere. Nobody today, regardless of where you are in the world, can be sure you have a job tomorrow. We're in the VUCA world, as they say, a world that is very volatile, a world filled with uncertainties, a world that is ambiguous, and a world that is constantly changing. So we are all under unimaginable pressures, both young and old. So what you find in the workplace is that you have stress, anxiety, burnout, depression, all sorts of trauma. And this is manifesting in absenteeism, presenteeism, quiet quitting, and all sorts of antisocial behaviors where the conflict level at work is at a new height. There's also the issue of workplace harassment. When people talk of harassment, it is not sexual harassment that is most prevalent. You have physical and verbal harassment. These are some of the mental health issues that are in the forefront of the workplace. Unfortunately, the people in human resource management are not knowledgeable about these things. And that's why you will hear management say to workers, drop your challenges, whether physical, social, or mental, at the gates. Come in and work. And when you are going back home, carry your baggages with you. Whatever mental challenge, whatever physical challenge, whatever social challenge an employee is having, if they're not properly addressed, they're going to bring them to the workplace. It is going to affect their performance. It is going to affect their productivity. It is going to affect the fortunes of the company in terms of bottom line profit and even long-term sustainability. And that's why we need to begin to address these issues. Thank you, Dr. Kemi Akintoye. Or will you want me to continue?
No, thank you so very much, sir. Sorry, thank you. All right, so Venerable had spoken to us about the uncertainty that we have in our world here now. And this uncertainty is really affecting a lot of things. More importantly, is the fact that quite a lot of people don't even understand where the next meal is going to come from, or even they go to, I don't know if you had passed through some of these factories where people will have to come very early in the morning, and then they will now select a number of people to go in. If you are not selected, then you can't go in and get the job done. That could also be very detrimental. You can imagine somebody going through that rigor, that pressure, that stress, and then somebody will now not select you, or they would even select you on top of And I was just saying here now that leaving your problems at the gate and then coming back to pick it up when you're going home, then who now solves the problem for me? Because it's as well as I am still carrying the baggage at the end of the day. So give or take, I'm still carrying the baggage. So that's a lot of problem. Now we talk about harassment in the workplace. And if you understand what harassment is, you would know that it is very frequent in the workplace now. Because a lot of people is also carrying their own baggage. They'll carry their baggage. They do not want to have somewhere to empty it on. So they empty on the subordinate. The next subordinate empty on another subordinate. And that becomes a culture. That becomes a trend in the organization, which is something that we need to look at. We talk about work-life balance, which Venerable has also mentioned. And the truth is, it's not balancing. The work life is not balancing in any way for quite a lot of people. And that is creating huge problem for people. So job demands, relationship with colleagues, organization culture, like leadership styles, these are some of the things that actually affect our mental health in the workplace. And these are some of the issues that we would be talking about today. Thank you so much, Venerable, for kickstarting that for us. And Dr. Digbaju is now going to talk to us about how do we recognize mental health issues in the workplace? What are the signs? How do I know that I have a mental health challenge? I am patiently listening to this because if I tick any of these boxes, I'm reporting to the MD and then I'm going on off. All right, over to you, Dr. Adegbaju.
Thank you so much, Dr. Akitoyeshi, for that. And I want to flow from where Venerable stopped. I mean, Venerable talked about what we see at the workplace. I mean, we'll start seeing things like absenteeism. People, because of the stress and the inability to cope very well with the stress, you find themselves absenting themselves from work. And this usually gets them in conflict with the management or especially the human resources department of most workplaces, because they see the human resources will start seeing this as productivity being wasted and there's no output. They don't want to start paying people without putting something of value into their business. Then, apart from absenteeism, we have presenteeism. Some people will be present at work, even though they are physically present, their mind is not there, which is very common in our environment right now. You find most people at work, until you even move close to them, before they even acknowledge that you are there with them. Some people are just not body, mind, and soul at work. And this, in essence, will lead to what we call, some people will become disenchanted with their work environment. There's decrease in productivity. Decrease in productivity will start leading to challenges, especially with your boss. If your boss is not the authoritarian one, you can imagine what will happen in the workplace. The person wants to lay down the law, will not want to take any form of excuses from anybody. And this will more or less lead to more or less like a verbal warfare on some of the workers. And as I said earlier, because we are wired differently, everybody has their own breaking points. Some people talk harshly to them from now to their kingdom come. They are like stone. Nothing will penetrate. Some are like jelly. Say a little bit of abusive words to them, and then all hell is let loose. So it leads to, and this kind of thing can also now dovetail to people having irrational fears. Fears that, if I go late to work, what will my boss say? And all these things can pile up, and the person can break down. Like I said, it will lead to some people, because they don't want to face this, they start indulging themselves in substance abuse. We've seen people smoking at their place of work, secretly smoking prohibited substances at their place of work. Some people start taking coffee to calm down their nerves. Some will go to the extent of taking a little bit of alcohol. And, some can even, energy drinks, because they now abound in the country so much, people now use it as if to ginger them at work. Another thing that we observe is changes of people in their behavior at work. People will no longer want to behave the way they are supposed to behave. I mean, you can imagine a doctor, because I would like to use my own profession as an example. You're at your workplace, you are supposed to see a client that needs help, that is looking forward to you, that is expected some support from you, and you yourself are irritable. Then it becomes a source of double jeopardy. So in as much as the workplace is more or less toxic, or more or less not that conducive, we should try as much as possible to mitigate all this stress that we are going through, because our own is to project, and because clients come to us, we should try to help them and solve their problems, not increasing their problems. So low engagement, you'll now find most people, when they are going through a lot of stress, instead of trying to engage people positively, they either withdraw into their shell or they start engaging at a low level. And this does not go well. It will cripple the system, especially in the workplace like ours. Thank you.
Thank you so very much, Dr. Adegbaju. When he said body, mind, and soul not at work, and I was trying to imagine, I said to myself, the body is at work, the mind is at home, or where you're looking for money. I don't know where the soul is. Maybe the soul is now fluctuating between the body and the mind, just for the individual to be able to find the balance. But that's what really happens a whole lot of times. So when people are burdened, stressed, you have quite a number of things that you want to achieve and you are not able to achieve it, and that could create a whole lot of problems for individual. Now you have people being frustrated on the job, and it tallies with what he had said earlier when he was talking about the common mental health issues that you will find at the workplace. I'm not happy, I'm not finding fulfillment, my life in itself is not going on well. Maybe my bosses are harassing me, there's harassment, verbal and physical, whatever you. Now it could affect our mood, depressive feelings and other things like that. And these are some of the things that we need to begin to watch out for. I remember there was a time I once had a boss, and once it is about 5 p.m. or 6 p.m. on Sunday evening, there is this irrational fear. Is it irrational? No, it's irrational fear. This one is not irrational. This one is rational fear that comes like, tomorrow is Monday. And then when it is now Friday, you say, thank God it is Friday because you're going to escape. And these are some of the things that happen. So when all of these signs are there, please understand that you need to be able to take care of your mental health. Luckily, I was seeing a patient before at the commencement of this webinar today, and then she ruled out quite a lot of signs associated with depression and as things that she wanted to discuss with therapists as what she was feeling like. And I started asking her a question, and she was talking about the issue of bullying, abuse, and other things that use of derogative words. She actually mentioned that our boss said, for lack of a better word, I would say you're stupid. Now, there's no better word. Which other word would she have used? She said, for a lack of better word, I would just call you stupid. Now, this is what she had been going through in the last 2 years. Now, one would not be surprised that she's presenting. One would not be surprised that she's having this. And these are some of the things that's happening. And when you are having all of these symptoms or signs, then it's a need to begin to prioritize your mental health. And that's what's going to lead us to the next question, where Venerable is going to tell us, how do you handle employees with mental health issues in the workplace? When people have mental health issues, now we're talking about stress, we're talking about anxiety, we're talking about, a lot of employees have panic attacks, severe panic attack. You see them jittering, it's like everything is just letting go. How do you help? What do we do? So people are on this call who wants to know because they are going through similar things. How do you help them? Over to you, Venerable.
From the perspective of an EAP practitioner, we won't even single out mental health. The value driver in employee assistance program is the 8 pillars or 8 dimensions of wellness. Because by the time you are singling out mental health, the issue of stigma comes in. The issue of accessibility to service comes in. Nobody will want to come to you. But when you look at the 8 dimensions of wellness, the physical wellness, the social wellness, financial wellness, intellectual wellness, environmental wellness, occupational wellness, if you look at it holistically, then you will have addressed every aspect of the human life. It is not just about the emotion, it's about the physical, the spiritual. So what we advocate in EAP is that in the same manner that you do your annual health checks, ensure that you do your psychosocial risk test So from the get-go, you know the state of the emotional health of the individual, the spiritual health, and then you begin to provide support services. You train them in coping mechanism, and they are able to lead a well-adjusted life. We also need to begin to train our HR practitioners in all these areas and on how to embrace employee assistance program. There are some toxic attitude in our work culture. In the banking industry, for instance, they work excessively long hours. They are given unrealistic targets. Work is not meaningful, not to talk of being fulfilling. These are areas that we need to begin to look at. Let me share a personal experience with you. Those of you who are old enough will know that sometime in the 80s and in the 90s, banks had staff buses all over Lagos. Why did they put those buses on the road? It was at the time that a lot of young ladies were coming into the banking industry. And despite the fact that they provided the buses because these young ladies were coming late. The drivers, instead of buying 30,000 naira fuel to fill the buses, will buy 10,000. The buses will be involved in accidents on the road. So it was actually not fulfilling the objective that it was set. So as EAP practitioners, we were brought in to look at what could be the issues. These people were coming late, and we provided buses for them, and they're still coming late. So what we did then was to do a survey. And this is why a lot of the things we do in the workplace must be evidence-based and data-driven. By the time we did the survey, we discovered that, a lot of young people were coming into the banking industry at this time. A lot of them were there in their childbearing age. So rather than buy buses on the whims and caprices of the HR people, why don't we try and establish crutches in the workplace? We experimented with crutches in the workplace. What we then discovered was that the ladies who were formerly coming late were coming in early because they can now entrust their babies to trained assistants. They can go up and do their work, being rest assured that the children are well catered for by qualified childminders. We also encourage that there are wellness breaks, that the mothers can come down to the crèches and breastfeed their children. So what do you have? Productivity went up rather than high labor turnovers because the employer cared for the employees. They were more willing to stay longer, and then the initial problem of coming late was solved. What am I advocating? There is need for both the labor unions, the employees, and the employer to begin to look at creative and ingenious ways of managing not just mental health, but total wellness. We need to understand that if you are financially broke, which is financial wellness, you will be irrational in your behavior. How many men are battering? There's a high rate of domestic violence, spousal domestic violence. It is as the result of the financial pressures people are going through. There is a high rate of gambling, substance abuse, drinking of energy drinks, as Dr. Adegbaju alluded to earlier on. These are negative coping mechanisms. But can we begin to enlighten people to address their challenges and issues in constructive, positive ways? Can job be meaningful to those doing it in such a manner that they will get job satisfaction, job fulfillment? And then when you get job satisfaction, when you get job fulfillment, it is bound to impact positively on your self-esteem and your contribution, not just to your family, to your community and the society at large. There is a need to go away from the traditional view of what health is to what WHO defined health to be, that it is not just the absence of sicknesses and infirmities. It is living a wholesome life, a healthy mind in a healthy body. That is my contribution for now. Over to you, Dr. Akintoye.
Thank you so very much, sir. And what Venerable had said will allude to what the medical director said earlier when he started this conversation, that a happy employee is would also naturally translate to having a happy workplace. I remember going for a webinar somewhere, and there I discovered that at 12 or 1, they would go for lunch, and everybody must leave their desk. You don't eat at your desk. You actually go to the cafeteria. The place provided, the organization actually provides meal once a day for them. Everybody leaves, and then they go to eat. And then at a certain point in time, there's a gym, the swimming pool, the table tennis, and other things like that, which is just to help them cope. And so that would also give credence to what Venerable said about ensuring an holistic aspect in the life of an individual. Is about the 8 pillars, ensuring that this individual is fine. And so when we begin to notice that there is a problem with some of the signs that Dr. Adegbaju had mentioned earlier, and individuals are still having mental health issues, and it's time to begin to have open conversations about it, like we're doing now. There's a need to start talking about these things. When people have issues, they must be able to come. They must be able to talk about their feelings. They must be able to talk about their challenges without necessarily seeing them as wanting to dodge work. The truth is, everyone currently living in this nation is going through a lot. The economic situation is not there at all, and that's putting so much pressure. Now imagine the drains that had gone in the workplace, and you have to now pick up several loads of job all together, and then you're doing that, the family pressure and all the things like that. So when there is no balance in the pillars of this individual, then this individual is not able to function. And that's why organizations must begin to have open conversations and have policies that would target towards helping people to be able to get themselves. And he mentioned the fact that HRs may not know, but this is about the breast cancer for people to also begin to educate themselves. So the more you know about it, the more help you will be able to provide for people going through one challenge or the other. You won't just see people going to panic attack and say, oh, it's just ordinary fear. No, it's more than that, because at the time when an individual is having a panic attack, most times it's like they want to die. They describe it as, it's like life is just zipping out of them. So you would want to provide the best of support, understand things from their angle, and then be able to help them to pull through. Thank you so very much. Quickly, I want us to all drop comments, whether positive or negative, different experiences that you have had in the workplace. I want to be able to hear from you. I will take as many as I can. Now, you could share with us positive or negative experiences that you've had in the workplace, and possibly how you were able to handle it, or how it's affected you. What were the psychological implications that it had on you? We would love to hear from you. We would love to read that. We would love to share and learn. So if you can quickly do that for us at this minute, then we would love that, while we still continue with our own conversation. And Dr. Adegbaju will be telling us, how can you as an individual prioritize your mental health in the workplace. Thank you, Dr. Dibak.
Thank you, Dr. Akintoye. And I want to thank Reverend for pointing out the pillars of wellness. As we all know, those pillars are interrelated and one will affect the other. That is why there must be a balance in amongst those pillars. And I also noticed it talked about the issue of crutches, which was a good one. But by and large, in the current situation of things we have right now in this country, I mean, the first thing right now in the workplace is for ability of people to set reasonable and realistic targets, realistic goals based on what is happening around us. Because if you set unreasonable targets, the person is likely not to be able to meet up to targets, which will lead to a lot of anxiety in the person. And the person will, instead of now, in an attempt to now want to do more work, might actually be doing less work or less productive work in the process. The other thing is that despite all that is going on in the country, the economic challenges, the price increase in fuel, increase in this, for the work to be done, the person doing the work must also eat. We need to eat well. Not necessarily something expensive, but at least we need that energy that is going to, gotten from eating to make sure the work gets done. We talk about exercises. I mean, and I love the example that Dr. Akintoye gave, that she visited a place where everybody will get up at. Everybody at a certain point in time will get up to go and have their lunch. Well, in some organization, that won't work, but in a hospital setting, that might not be 100% possible, because as we all know, emergencies can come in at any point in time, and if everybody goes to eat, there'll be nobody to deal with that emergency. So maybe they have to do it in batches. Maybe that one will work, because like I said, you can't all work. If you continue working, and there's not even time to even take a break. As we all know, power is not constant. Power starts dropping as time goes on. So the longer you are working and there's no rest, the power starts dropping or the energy level starts dropping. So there's always be a time for relaxation, no matter how short. Maybe after working effectively for like 3 hours, you take a 5 minutes break to more or less cool your head or cool your nerves. And then you find out after taking that break, you are more energized than before to continue instead of working throughout. Like I said, the longer you work, the faster your power drops. I always advise people also in the workplace, we need to sleep adequately. I know that we are going through a lot in this country, but sleep is not something you compromise. I liken lack of sleep to a generator that keeps on working non-stop without rest. That generator will pack up in no time. Sleep is essential because we need it to cool down our brain and to also remove some toxins in our system. I know that some people say, oh, I live in Abule Egba, I work in Yaba, before I take the transport to work, you wake up at 4 a.m. to meet 8 so that you will resume at 8 a.m. so that your boss will not be angry at you for coming late. And when you close, you might not get home until like 8 p.m. or 9 p.m. due to the traffic situation of the country. But we should, in all honesty, try to sleep between 6 to 8 hours so that we can be rejuvenated, so that the work the following day can go on. And Dr. Akintoye also talked about talking to people. Yes, we also need to talk to trustworthy people, because that is what people are usually afraid about. You don't want to talk to somebody who will more or less start broadcasting your problems to the entire office. So it must be someone who is trustworthy, who they can, tell their problems to, be able to give advice on what to do and know what to do. We should also new things have the way of making new connections in the brain. And this one would dovetail to mindfulness. Mindfulness practice when we need to now more or less take advantage of all our sense organs to appreciate nature. I know majority of us will say this is not an African thing because of all the myriad of problems we have, but these are things that will work. These are things that will work. And then we also learn to create room for, like I said, create room for exercise. And then if all these fail, because this is where people tend to run away from us. When all these measures fail, I've always been telling people, gone are the days when there's stigmatization or people are afraid to enter the confines of our hospitals. You can easily walk to a federal neuropsychiatric hospital, Yaba, Lagos, where we have all the professionals. If you don't want to see the psychiatrists, which many people fear, for the fear of being labeled, the psychologists are there. The social workers are there. The nurses are there. These are all parts of the mental health team. And me talking to them and receiving more information on what you can do can more or less make a positive impact in the life of the person.
Thank you, Dr. Adegbaju. And that was very, very instructive in terms of what we can do to begin to help ourselves as individuals. I was sharing somewhere yesterday, and I said that the government organization may not be able to do a lot for you, but you have the onus to do a lot for yourself. And what he had said about sleep, about diet, about exercises are things that you can do for yourself. So we must take on the responsibility of doing quite a lot for ourselves so that we can get better and then we are able to function and function adequately. This is very, very important. Okay? All right. So again, I was just also looking at some of the things that he had said. This eating issue, I don't know. Because if you would eat belly food now, like your brain, people will talk about it's like a king in the morning, and like a prince in the afternoon, and then at night you eat like a pauper. But even to eat like a king now in the morning, it's becoming very difficult. Sometimes we are eating like pauper. Our brain is not charged to take on the whole responsibility. Maybe before the end of this order, it's still going to tell us how we're going to manage it. Because excuse me, when the stomach is not full, and you're not able to do any other thing. Thank you so very much, Dr. Adegbaju, for that. So please, let's take note of some of the salient points that he had said. A lot of us didn't send in anything about our work experience, but thank you, Mr. Laro, for sending that the KPI set for work first should be SMART. Yes, should be SMART. I love that acronym is very, very important. We must be able to leverage it against quite a lot of things. Realistically speaking, what can we achieve? How can we do the things that we need to do? Ismail Yakin, your questions will be taken on as towards the end. I don't want to interrupt the flow of this conversation. We'll go back to Venerable now. He's going to talk to us about the things that employers themselves can do. I hope there are employers available on this call. What can they do to prioritize mental health in the workplace? Over to you, Venerable sir.
All right. Some of the things employers can do, and they've done in the past, unfortunately, because we have lost everything that, most things that are of value in this nation. I remember back in the days, Cadbury had a staff canteen, and they used that staff canteen to promote all forms of wellness. There was a time it was no smoking. There was a time they used it to reduce the salt intake of their staff. There was a time they used it to promote drinking water, and as against drinking alcohol and things like that. If a dear friend of mine was then the medical director, he later became the Dr. Dokunwadidiji. Now, what employers are currently doing, the forward-looking employers, number one, they are introducing EAP into their workspace and educating their staff across board about the need for maintaining wholesome health, of which mental health is one of. Employers are also beginning to produce confidential workplace counseling services where you can go and vent and air your problems, and your secret will remain secret. They are providing workplace counseling services. They are engaging physical instructors to do wellness exercises in gyms, mindfulness exercises. They are encouraging people to be intentional about living. Dr. Adegbaju made mention of eating well. They ensure that at least one decent meal is served at work. They encourage their employees to take their leave as at when due. They encourage them to do, I have been privileged to talk about the value of sleep to an organization. They encourage them to play well and then work hard and work smart. They are also having coaching and mentoring sessions. They are having home bosses where you can air your grievances openly without negative consequences. They're doing lunch and learn. A host of things are being done in the contemporary workplace. We're not there yet. In places like South Africa, there are legislations regarding EAP. If you have a particular number of staff, you must have an EAP advisor. And this we see in our telecom industry and in the oil and gas industry. These are some of the things that we can embrace. I believe the neuropsychiatric hospital, you have all it takes. And I'm appealing to Dr. Uweye, and I'm willing to partner with the power that be there, the different health order. By now, because your staff are overworked, where they are supposed to see 8 to 12 patients in a day, I make bold to say that they see 20, 30 patients in a day. What kind of relief do we have for them? Maybe it's time that we begin to do what we preach. Let us also see ways of establishing EAP within Yaba, and all that it takes. The psychologists are there, the social workers are there, the psychiatrists are there, the nurses are there. Let us also do that. I'm glad to announce that, Nigerian Employers Consultative Association, they are looking at us partnering with them to do the next EAP summit and begin to advocate wholesome wellness in the workplace. CIPM also, they have indicated interest and will be training their people on the fundamentals of EAP and wellness generally. These are some of the things we need to do. And the labor union need to be alive to its responsibility to ensure that the workplace is safe and the atmosphere is conducive to productive work. These are some of the things we can look at. We're all stakeholders in these matters, and we should join hands to ensure that our human capital, which is the most valuable resource in the workplace, is well looked after. It is when we look after the human person that they can deliver on their job task and fulfill all demands and responsibilities expected of them. Thank you, Dr. Akitoye.
Thank you so very much, Venerable, and Venerable has said very germane points. But I just want to reiterate on one point that you've mentioned, because I want the medical director to be able to hear it very well. You said one decent meal per day. that the organization should provide for us. Okay, so Dr. Oweye, sir, they say 1 decent meal per day. Thank you very much,
Dr.
sir.
Kemi, looking at you, you may not need that meal. If I'm prescribing, I
Don't say
will
that,
ask
sir.
you to go on permanent fast.
All right, so thank you so very much, Venerable, for that. That's very, very important point that he had raised. I'm going to quickly take some comments from the chat box. Excellent presentation, Olani. Adeyemi. I want to use the medium to appeal to the management of the FMPHY to start providing light meals for all the members of staff. If not in place yet, I did not even plan with this person, and they just told us. So please, I don't know if we will meet in the MD's office after now. Okay, so Tolu Lokpe and Toby says, I remember years back I was posted as an admin staff in a department in one of the federal hospitals across the country. He had a subordinate who was elderly and domineering and who didn't make work very conducive for us. You had to leave the office for that person. You can imagine coming to the office and you don't know what it's going to meet like, and it's going to be scary for you. She said until she was eventually transferred to another unit, that was when she was happy and ready to work again. Obi, yes, the recording of this program is on the YouTube page of Yaba Voice, Yaba Voice, FNPHY. You would get the recording of this particular episode as well as previous episodes of the Yaba Voice webinar on that. So you could easily access, you could share also to friends and family. Dr. Mustafa Sombe said, for me, I experienced a large dosage of verbal aggressiveness, but I have been fortified from the dynamic large family background, coupled with self-understanding and later my research work into emotional intelligence, psychological well-being, and full awareness of help-seeking behavior. Thank you, and I'm very grateful for learning and home training, which is also very important. The background, the environment, all of those things have very, very significant role to play in all that we go through. Olani, yes, the recording is going to be sent to the Yaba Voice YouTube page, Yaba Voice FNPHY, one word. You will get this recording as well as episodes of other recordings there. Please subscribe as you're checking that. You can also access this on Facebook. It's also there. Then thank you for this topical. Okay, so that will take me to the question that Ishmael Yakin asked. The question is, what are the ingenious measures the management of Yaba are adopting as a preventive measure to ameliorate the situation as suggested by Venerable? And I think those are part of the things that Dr. Adegbaju as well as the Venerable has spoken about earlier. Don't forget that I would be bold to say that the medical director, Dr. Olubenga Dekile, had been working and is still in the pipeline to have the EAP program for this hospital. That has been in the pipeline, and I'm very sure that sooner than later, that will start up as soon as possible. So I know that work is on to make sure that staff have access to some of these things. And we have the crutch, we have some of the things, but some of the things are not in place. I know that the medical director is listening, especially the food part, and he would be able to help us to do something about it. I'm quickly trying to read up. Ede, thank you. We really need to learn to balance work and our mental health if we really want to be productive. Thank you so much for that. Tolu Ogunaike said the hospital can make provision of staff the hospital can make provision of staff having access to a cup of tea and bread. Okay, Dr. Where, yes, sir. Tea and bread, it's possible. Thank God we have bakery. It's even very easy. Bakery is there, and then they can easily just give it to us. So I strongly recommend a quality assurance team to regularly run survey on what can affect staff to improve productivity. And I agree with this. We can't have a research from all of this, a research that would help us to be able to move on. And somebody is also sending a personal message to me that we can even have more staff quarters so that people would not have to travel from Abule Egba and all the lights, Songo, to come to the office work. So these are very, very important things that we need to do. But beyond what management needs to do for us, please let's note that it's quite important that you also know that you have a responsibility in prioritizing your mental health in the workplace. Know your boundaries, know your capabilities, know your strengths. Eat well, drink water, sleep, rest, exercises, they are very, very important. The locus of control does not just lie with the management or the employers alone, it also lies with you. And so you must be able to know, you don't just take in. Saying no to your boss doesn't mean that you're rude. You can, excuse me, sir, can you allow me to finish this at this moment? Yes, they would open their eyes at you and say, hey, they did not teach us like that. We are from Yoruba culture. But excuse me, you know that these things would have to just learn to start adopting it. If we do not adopt it, then we cannot get it right. And this is a time to get it right. And so I'm going to take the last word. I'm starting from Dr. Adegbaju, the Venerable, the MDK director also has something to say to us about all that we have said, then we will now close. Dr. Adegbaju, over to you, sir.
Yeah, thank you very much, Dr. Akitoyeshi. I would like to round off my own part of this webinar by saying that every person has to protect their mental health and guard it jealously. There is no health without mental health, and prevention is better than cure. We should do everything in our capacity to make sure that our mental health is sound. As we all know, treating mental health issues is not child's play again in this country. So I want to implore everyone listening to me on this webinar to please make sure you guard your mental health jealously and don't break down mentally. Thank you very much.
Dr. Adegbaju, it's not mental health. It's not just treating mental health. Treating health generally. Do you know what they say paracetamol now? Treating health. So please take care of yourself. Thank you so much for that. Venerable, sir.
Well, I will say, just emphasizing what has been said, that my late father used to tell me that you are the architect of your fortune or misfortune. You have the individual responsibility within the resources available to you to ensure wellness. What you will get is institutional support. And at the risk of thanking Dr. Weye, I'm so pleased with what Dr. Akitoyeshi said, that a lot of welfare consideration are being made that are already in the pipeline. I sincerely want to thank your leadership style. I've said it once, and I'm saying it again, that in your time in the psychology department, if 5 people wrote their PhD thesis, defended them, the credit is yours, because you are leaving legacies of making Yaba Neuropsychiatric Hospital a learning institution that it is and ought to be. So I thank you again for inviting me. I thank everyone that is on this call. Yes, mental health is important. The 8th dimension of wellness is the foundation of health. Thank you very much.
Thank you so very much, Venerable, for that closing remark. We appreciate you. And I can assure you that some of the things that you had recommended, the management have heard. And I'm sure that also employers of labors who are also here have also taken note of that. And then we will be able to do better. Dr. Olubenga Dekileweye, one last word from you, sir.
Thank you very much, Dr. Kemi Akintoyeshi. My parting word is that prioritizing mental health in the workplace is not only a moral imperative, but a business necessity. Therefore, by prioritizing mental health, we can unlock the full potential of our workforce and create a healthier, happier workplace culture. Thank you for now.
Thank you so very much. Such a strong word to part with today. Prioritizing mental health is not just a moral necessity, but also a business necessity. You know, like the song that they will sing, that collabo. It is a collabo. Everything must come together as one. so that we can understand what needs to be done. So as much as you're doing it for yourself, the organization is also profiting. And you understand that it is all about our health and our wellness. And so please and please, let's play a role, and then the organizations will also play their role. I am sure that the medical director is looking into getting us a meal today, a decent meal. It's going to start today so that we can begin to fulfill all righteousness. Thank you so much, Dr. Ware. He's laughing. Thank you so very much. So Lu Ogunaike said a lovely presentation and timely. Kudos to the organization. Thank you so very much, our speakers. And thank you. Until we come your way again next month, when we'll be looking at healthy men in an unhealthy world. Healthy men in an unhealthy world. That is what we're going to be looking at. God's willing, by November, by the grace of God. So we hope to see you then. So please, the recording is on the Yaba Voice YouTube page, Yaba Voice, FMPHY. You would get this recording as well as previous episodes of the Yaba Voice webinar on that recording, and also on Facebook. You would also be able to access it. Until then, please stay healthy. prioritize your mental health. It's important. You have that onus yourself. Bye-bye. Take care of yourself.
Thank you.